Hello, and welcome to the Group 1 Accreditation Plan for the Tipton County Health Department, located in Tipton, Indiana. Located in central Indiana, Tipton County comprises 10 cities, towns, and townships in nearly 260 square miles in area, with an overall population of 15,162 residents. The Tipton County Health Department, or TCHD, located in the city of Tipton, is currently unaccredited, with COVID-19 pandemic-related illness and vaccination efforts superseding all previous departmental initiatives. The TCHD has a mission of protecting and improving the health and environment for all people in Tipton County by working together, while maintaining the 5 values listed here which guide their work. The most recent Community Health Needs Assessment, created by Indiana University Health Tipton Hospital in 2018, established 6 priority areas of need in both Tipton County and neighboring Hamilton County, the main areas which the hospital serves. 3 different community health priorities were noted by the current Tipton County health nurse in May of 2021. The community health needs detailed by the TCHD are human papillomavirus, or HPV, COVID-19, and public health education, and these topics will be explored further in the following slide. For the purposes of this plan, the group will focus on the path to accreditation for the TCHD, including establishing accreditation documentation, including a community health assessment, community health improvement plan, and a strategic plan, addressing the most pressing health issues in Tipton County currently, as well as the goals and measurables to determine progress within the TCHD. After speaking with Connie Parrish, the county health nurse with the TCHD, and identifying 3 important areas where the department is currently focused on to better the community's health, we were able to get further information on each area of focus. The first issue Ms. Parrish discussed was HPV, the push to educate the public about what HPV is, the vaccine, and why it is important for parents and young adults to get the vaccine. Currently, the rate of vaccination in Indiana is 33.5% for males and 48.4% for females. Parrish partnered with the oncology department coordinator at the local hospital to promote the HPV vaccine and put together resources to help educate the public, and the percentage of vaccinated in the community increased significantly with this effort. The second area of focus for the TCHD is COVID-19. A vaccine clinic was set up in the IU Health Tipton Hospital to provide free vaccines, as well as providing up-to-date education regarding the virus and the available vaccine. As of June 17, 2021, 5,132 individuals in Tipton County are fully vaccinated. The third area of focus, according to Parrish, is education. She discussed a recent grant which promoted breast cancer screenings in education. Unfortunately, the turnout was low and demonstrated the challenge of educating the community, coupled with active participation in the programs or opportunities provided. Currently, the TCHD provides a wide range of services and classes, including blood pressure and cholesterol screenings, as well as tuberculosis and blood lead level screenings and educational presentations. Goals and measures. A balanced scorecard, or BSC, comes from the idea of looking at strategic measures in addition to traditional measures to get a more balanced view of performance. The balanced scorecard was originally developed by Dr. Robert Kaplan of Harvard University and Dr. David Norton as a framework for measuring organizational performance using a more balanced set of performance measures. A key benefit of using a disciplined framework is that it gives organizations a way to fill in the gaps between the various components of strategic planning and management. In other words, it creates a visible connection between the projects and programs that people are working on, the measurements being used to track success, the strategic objectives the organization is trying to accomplish, and the mission, vision, and strategy of the health department. We created a BSC to evaluate the TCHD's accreditation process. We included goals and measures for the following categories: financial perspective, customer perspective, internal process perspective, and organizational capacity perspective. We recommend the TCHD utilize the BSC to help achieve their accreditation goals and reevaluate as necessary when it is time to renew documents and accreditation. Our first goal relates to the financial or stewardship perspective. Our financial goals for the TCHD are to evaluate the current operating budget to assess funding for dedicated accreditation staff, as well as identify grant opportunities to fund new programs and initiatives to address their primary areas of focus. The main measure for these goals will be related to accreditation development and implementation of new programs addressing the primary areas of focus. Our second goal relates to the customer or stakeholder perspective. Our customer goals for TCHD address the collaboration between government and the public. Main measures for these goals will be related to use of community focus groups to obtain insight on community perspective. In addition, measures will evaluate data for new programs addressing their primary areas of focus in relation to behavior change. Our third goal relates to internal process. Our internal process goals include implementing processes to collect and analyze data. A main measure for these goals is usable, reliable data for incorporation in required PHAB deliverables. Our fourth goal relates to organizational capacity or learning and growth. Our organizational capacity goals will focus on the culture within TCHD. Main measures for these goals include developing a culture supportive of obtaining accreditation. The following slides will focus on the recommendations presented in the accreditation plan to better the services and quality of those services made available to Tipton County residents by the TCHD. These 4 recommendations are aimed to focus the attention of the TCHD on issues that are important to the community, while drawing in more stakeholders to have a larger pool of resources to allocate the proper attention needed to complete the process of PHAB accreditation. Recommendation 1 focuses on establishing more community partnerships because according to studies like the one conducted by Carlton and Singh in 2018, having more health entities in a community focused on health betterment gives more resources to draw from and more people focused on the same issues. One example already seen is the crafting of the CHNA from the Tipton Hospital, which meets the requirements of a PHAB required community health assessment. The second recommendation for the TCHD is to utilize the CHNA created by the Tipton Hospital to craft a community health assessment and use this to create a community health improvement plan and strategic plan, which are the 3 documents required for accreditation by the PHAB. The CHIP and strategic plan will outline goals and measurables to determine if the goals are met, and in the strategic plan specifically, SMART goals, which are goals that follow a structure that is specific, measurable, achievable, relevant, and time-oriented, as laid out in the specifications of the National Association of City and County Health Officials. The third recommendation for the TCHD is to devote resources to efficiently finishing the accreditation process. This may require encouragement, but as many studies have shown, including a study by Ingram and colleagues in 2018, accredited health departments offer a wider range of services, have more partnerships with local stakeholders and more financial backing from them, and have a higher percentage of health systems. Showing the TCHD studies that exemplify these points will hopefully induce them to pursue accreditation status without delay by devoting the needed resources to this project. The fourth and final recommendation to the TCHD is to align its health issues with the ones that are important to the residents of Tipton County, as laid out by the 6 discussed previously noted in the 2018 Tipton County Hospital CHNA. Our TCHD contact, Connie Parrish, indicated the 3 most pressing issues seen by the TCHD currently do not align with the issues most important to the public. Study after study, including one conducted by Hahn in 2005, demonstrates that the most effective way to draw in more stakeholders, while also keeping residents interested in the pursuits of a local health department, is to focus on issues important to the public. This does not mean all 6 need to be pursued at once, but that some of these issues should be top priority for the department to be trying to tackle at this time. The final step of the accreditation plan is the intervention strategy, which is a three-step solution developed by the group in order to help the TCHD reach accreditation status most effectively. To most effectively reach accreditation status, the TCHD should first commit to accreditation after reading the accreditation plan and seeing the benefits of having this status based on the literature presented. Next, the TCHD should form more private sector partnerships, as these are the partnerships that will yield more donation money to bolster the budget of the TCHD. Finally, the TCHD should use this additional money to devote resources to finishing the accreditation process that includes the development of a CHA, a CHIP, and a strategic plan. This is the most effective strategy going forward for the TCHD to pursue to become an accredited health department, giving the viewpoints of the staff and the current resources available to the TCHD. These are references to resources cited throughout this presentation. And these are the references to illustrations used in this presentation. We hope that you have enjoyed this presentation and believe that the accreditation plan laid out for the TCHD is an effective strategy that will empower the department to continue and bolster its efforts to better the health of the Tipton County community. Thank you.